Hey guys, welcome back to Corsetta Nursing. Today we're going to go over acute kidney injury. We're going to go over all those concepts that you need to know about for your next nursing exam. Before we get right into it, make sure you guys know that you can download our free pathophysiology concept map that goes directly along with this video so you can take the right notes to succeed on your exam. So let's get right into it. If you've watched one of my videos before, you know that we dive really deep into the pathophysiology because once you know that, every other concept they could ask you about in one of those nursing exam questions is going to make a lot of sense to you. So we're going to go and reflect on pathophysiology first. So first of all, acute kidney injury. What is the difference with chronic kidney disease? Well, acute is of course fast, so it happens suddenly, where chronic is more of a long-term illness. So when some patient goes into a hospital and you hear them say they have an acute kidney injury, this is not related to a chronic kidney disease. It could be stemmed from it, built upon it, but it's a sudden worsening of kidney function. So it's an interruption of the kidney function. But how do we actually know if someone has acute kidney injury? We'll get into the diagnostics later, but to go over it real briefly, it is the GFR. Now with the pathophysiology of acute kidney injury, it's a little unique because there's 3 different types of causes that have different pathophysiology underneath each one of those. So we're going to unpack each one so that way you guys can easily understand it for your nursing exams. This is the most commonly questioned about concept under acute kidney injury for your renal exam that you might be taking soon. So make sure you guys pay attention to this and write your notes down. So we have pre-renal, intra-renal, and post-renal acute kidney injury. So what does pre, intra, and post mean? Well, pre, of course, is what? Before. Well, if we understand that pre, of course, means before, we're going to understand this. So the failure doesn't happen because of inside the kidney, what's going on there, or what's going on after the kidney. It's happening what's going on before the kidney. So one of those things that we've talked about before in one of my courses is that the kidney is the neediest organ in the body because it regulates all sorts of things. Blood pressure, electrolytes, so on and so forth. Well, it takes 20% of our cardiac output. So that's a pretty large number. So our kidneys are very sensitive. They know exactly what's going on in the body and they can make accommodations to make sure that they are getting enough blood. That's all the kidneys are really worried about, is that they need enough blood, oxygen, and nutrients to properly function so that way they can maintain all the balances they're responsible for. But when there's any sort of deficiency of blood reaching that kidney, they're going to make compensations to either the blood pressure or electrolytes or what happens with the fluid in our body. So I want you guys to write this down. Pre-renal failure means something is happening before it actually reaches the kidneys. So what that is hypotension. So we have a low blood pressure. If you guys think of the analogy of when you go outside, maybe you're an outdoor person, where you had a hose and it would go further if you put your thumb over the top of it. That's because you're actually constricting that space so it can actually propel further. So think of that like our blood pressure. So when we have hypotension, a low blood pressure, that blood getting pumped out of the heart is not reaching and really circulating the kidneys like they want. Same thing with hypovolemia. If there's a lack of enough volume in that vascular space, once again, they're not getting enough oxygen and enough nutrients to keep them happy, so they're going to compensate. Well, when there's a deficiency, it eventually can cause an acute kidney injury, so we're actually injuring that renal tissue. So when an injury occurs, then they are unable to compensate like they should, and all other checks and balances inside our body may go off. So once again, one of those telltale signs of acute kidney injury is a decreased GFR. So that's one of those things that could happen due to pre-renal acute kidney injury. And especially if the whole reason was because of hypotension, this is not a good combination because now the kidneys are unable to compensate and really increase that blood pressure. So we have a hypotension that could potentially be uncompensated. So overall, make sure you guys know this is commonly questioned about is the actual causes of what pre-renal, intrarenal, and post-renal means. Well, pre-renal, it's your 2, hypovolemia and hypotension. Now moving on to intrarenal. So intra means within. So the failure is due to what's going on within the kidney. So intrarenal, it's a structural injury to the actual kidney itself. Think of it like this. What happens if you injure your ankle or you twist it? It gets inflamed. So when there's a direct injury within that kidney, the kidney is going to have inflammation and it could cause necrosis of that renal tissue. And once again, a decreased GFR will result, showing that it's acute kidney injury. So what are those 2 things that you need to know about to reflect on what causes this on an intrarenal acute kidney injury? It is 1, toxins. So medications such as your NSAIDs. That's a huge concept that you want to write down. Intrarenal failure. One of those causes is medications such as NSAIDs. And then others is infection such as pyelonephritis. So that is an actual kidney infection. So that's those two main causes that you'll want to write down that the NCLEX or the nursing exams love to reflect on. All right, the last one is post-renal. So post means after. So anything that happens after the kidney that can cause acute kidney injury. What is that? Well, we think, what's after the kidney structurally? We have a ureter that goes to the bladder, and then a urethra that, of course, helps expel the urine that's collected in the bladder. So post-renal, anything that happens in those spaces, the ureter, the bladder, or the urethra, if there's any mechanical blockage or obstruction that happens, it could actually propel back up to the kidney and cause damage that way. So that is your post-renal acute kidney injury. We're going to get into signs and symptoms here in a little bit, but one of those hallmark signs and symptoms with post-renal failure is if it happens to just one kidney. So if it's a unilateral issue, post-renal is more likely. So what could possibly cause an obstruction post-renal? Well, we think of kidney stones, right? Where's the most common location a kidney stone gets stuck? Well, it's the ureter. So if it gets stuck in the ureter, it causes issues. The kidneys cannot filtrate like they want, and then it's going to cause, once again, a renal injury or acute necrosis. Another possible obstruction post-renal is benign prostatic hyperplasia, which is, of course, your enlarged prostate. So to really quickly summarize all three of those, pre-renal, intrarenal, and post-renal. Pre-renal, you got your two H's, hypovolemia, hypotension. Intrarenal, it's something within the actual kidney itself, so toxins, so think medications such as NSAIDs, or think direct infections such as pyelonephritis. And then post-renal is after the kidney, so obstructions or blockages that could travel back up to the kidney and cause damage. So we have mechanical obstructions such as kidney stones that get lodged in the ureter, or BPH. Now, if you already understand the chronic kidney disease signs and symptoms, you're most likely going to understand the acute kidney injury signs and symptoms. So it's really not any much different other than the fact that acute kidney injury is a very fast progression of kidney failure versus chronic kidney disease is a slow progression. So it's not as obvious as acute kidney injury is. So one of those hallmark signs and symptoms, of course, with anything with kidney failure, we're talking oliguria or anuria. What does oliguria mean? It means a urine output less than 30 mLs every hour. That's something we could easily measure if someone has a Foley catheter, which is usually indicated with these patients so we can keep a close eye. And then we have anuria, which is a complete absence of urine output. Well, if we have a complete absence or a low urine output, where does that fluid go? Well, it stays in the body. So what happens when we get fluid overloaded? We have weight gain. Now, hemodynamic-wise, this is really unique to each patient. We could either have hypertension because of the fluid overload or hypotension because the kidneys cannot compensate due to that renal injury. And then we have tachycardia typically as well because it's stressing the heart out with the fluid overload. So it really depends on the specific pathophysiology of your patient. Now, if you remember with chronic kidney disease, we have also electrolyte challenges. And one of those biggest electrolyte challenges is potassium. So when potassium can't leave and it builds up in our vascular system, we have hyperkalemia. What are one of those things that we really need to watch out for with any potassium imbalance is the heart rhythm. So what happens if we have hyperkalemia? Remember, this is a very quick reflection, is that we have high peaked T waves and a potential ventricular arrhythmia such as PVCs as well. Lastly, be on the lookout for anorexia because we have fluid overload. That fluid can engorge in the body and causes pressure into the abdominal spaces. So it's going to decrease your appetite. And then we also could have altered level of consciousness because of sodium being imbalanced as well. Now, of course, once again, we're going to get into the diagnostics, but if we see a lab values that have high creatinine, a low GFR, a high BUN, then we can likely assume that something is going on with those kidneys. And don't forget, we mentioned this earlier, if it's a unilateral kidney issue, it's most likely related to post-renal failure because we typically don't have a bilateral mechanical obstruction with a kidney stone, for example. Hey guys, it's Wilker Patrick, nursing educator inside Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. Now let's go over the causes of acute kidney injury. So we talked about pre-renal, intrarenal, and post-renal. But let's give you some direct examples. We gave you the generic pathophysiology understanding, where pre-renal was either hypotension or hypovolemia, or intrarenal was a direct attack on the actual kidney itself, such as toxins with medications or infection, or post-renal being in a mechanical obstruction once again with either a kidney stone or BPH. But let's actually get into some other examples that the NCLEX or the nursing exams would like to reflect on during those case scenarios type questions. So really all you have to think is what can cause hypovolemia and what can cause hypotension? So things such as diuretics. Diuretics, if you expel a lot of volume out of your body, you're going to have hypovolemia. Or things such as losing volume through vomiting or diarrhea, or any actual pump issues with your heart, such as heart failure, or you have heart arrhythmias where the rhythm's not adequately perfusing to those kidneys. All right, what about intrarenal? So we talked about medications, toxins, and also the actual infection, so pyelonephritis. So what can cause those? So the big three medication classes that you wanted to know about for your nursing exams or NCLEX is number one, NSAIDs, and then you have ACE inhibitors, and then you have aminoglycosides. Make sure you guys write this down, understand the classes, know how to identify those common suffixes, and make sure that you understand that those medications could cause intrarenal acute kidney injury. Another major one you want to write down is IV contrast, especially when combined with a patient who's taken metformin. That's another example of intrarenal acute kidney injury. That's a direct attack on the renal tissue. And one more special condition that's considered intrarenal acute kidney injury is rhabdomyolysis. We will have another course on our content if you want to learn more about rhabdomyolysis. And then with post-renal failure, so we talked about mechanical obstruction. So anything that can cause a mechanical obstruction, such as kidney stones or BPH. What are some other causes? Well, if we have a urinary tract infection, that's a post-renal acute kidney injury if it travels and injures the kidney. And then other things that can cause an obstruction is a tumor. So if there's a tumor growth that's blocking the ureter or the bladder or the urethra, or if there's an actual blood clot that could be blocking that as well. So guys, if we understand those causes, we're going to easily understand those risk factors. So anything that can cause hypoperfusion, hypovolemia, direct attack on that kidney, or mechanical obstruction in the GU system itself, then you could have an acute kidney injury. Not to make a really short list, we're going to go ahead and put the most common ones that you'll see on your nursing exams and NCLEX, so make sure you guys write those down. All right, so what about the complications of acute kidney injury? There's all sorts of complications that can happen because, once again, the kidney is responsible for lots of bodily functions, but the biggest ones is maintaining blood pressure, so hypotension, so hypoperfusion that happens to the rest of the body, and then also we have electrolytes. Electrolyte is a huge deal. If we cannot adequately expel electrolytes out of our body, we're going to have a buildup of all sorts of problems and a buildup of fluid. So we have hyperkalemia as a common complication with electrolytes, and we have hyponatremia because of the fluid buildup. So the actual water balance is not adequate because we can't either get rid of fluid or get rid of sodium. What happens to other organs if we have too much fluid? For one, you're going to stress out the heart, so you could potentially cause heart failure because there's just too much volume. Secondly, we're going to mess with the brain because anytime there is a low sodium in the blood, that can cause some big issues such as altered level of consciousness, as we mentioned earlier. If we are having a backup of fluid in the heart, then it could cause pulmonary edema. And another thing you may see is that when acute kidney injury happens, it's unable to actually balance the bicarbonate with the acidic content in our blood, so we're going to have metabolic acidosis. And just like chronic kidney disease, where calcium and phosphorus are also affected, we're going to possibly have hypocalcemia and then hyperphosphatemia. All right, guys, now moving on to labs and diagnostics. So those big three values that you want to know about for any renal panel is creatinine, BUN, and GFR. Now, I will say creatinine and BUN are the most commonly tested ones, but GFR is actually what we look at to really diagnose acute kidney injury. So if it's less than 60, we're seeing that there's a potential issue with the filtration rate itself of the kidneys, which points towards an actual renal injury. So a low GFR, a high creatinine, and a high BUN are signs of acute kidney injury. And then we just talked about electrolytes, so we're going to have hyperkalemia, hyponatremia because of the fluid overload again, hypocalcemia, and hyperphosphatemia. And don't be surprised if you see metabolic acidosis with your patient, which can cause other signs and symptoms. If you guys don't know those, make sure you guys go watch our acid-base imbalances video. Now we're on our last section, is the management and nursing interventions. Now before we go over the actual general management of acute kidney injuries, I want to make sure you guys know that it really depends on the underlying cause. We talked about pre-renal, intrarenal, or post-renal. Well, of course, it's going to depend on which pathophysiology is really causing this entire issue itself. But we are going to give you a general overview of how to handle acute kidney injury as a nurse at the bedside and how to understand it for your NCLEX or your nursing exam. In general, what are the main issues that we need to treat with acute kidney injury? Well, number one, they can't get rid of fluid. And number two, they can't get rid of electrolyte. And number three, the blood pressure is either going to be really high or really low. So it just depends on our patient. And it also depends on how severe the acute kidney injury is as well. So one of those medications that helps get rid of fluid, of course, is diuretics. So that's something you may expect in the treatment plan for your patient. And of course, if they have hypertension, you can expect some antihypertensive. One of the things that the NCLEX and the nursing exams love to ask about on the nursing side of things is diet. We need to understand what diet should we promote with our patients with acute kidney injury or chronic kidney disease. Well, of course, it's the renal diet, but what is the renal diet? Number one, it's low protein. Why low protein? Well, the more protein that you have, the more stress it's going to put on those kidneys. So we want to lower the protein intake, and that way we're not stressing out the kidney even more. We also want to promote low sodium, low potassium, and low phosphorus. Now you may be thinking, why would we say low sodium if we're hyponatremia? Well, you got to think it's the only reason why it's hyponatremia is because we have a high amount of volume. So it's dilutional hyponatremia, not because we don't have enough sodium. We have enough sodium, but the only reason why it's hyponatremia is because there's just so much volume sitting in that vascular space, so it's diluting it out. So if we were to go ahead and try to replace it with sodium, we're actually making the problem worse, because what does sodium do? It sucks water, so it retains water even more. So we don't want to introduce even more sodium into the body and promote more fluid retention. And of course, once again, hypervolemia, we want to get rid of the fluid, so we might put this patient on a fluid restriction, once again, depending on how bad the acute kidney injury actually is. So what are those things we should do as nurses? We should daily weights. Make sure you know that it's daily, not weekly. The NCLEX loves to trick you on that it's daily weights, strict I's and O's, potential fluid restriction. And we want to really monitor for those complications such as altered level of consciousness due to that sodium, ECG changes because of that potassium, and really closely watch that blood pressure as well, because depending on how bad the injury is, it could either be hypertension or hypotension. Now going back to medications, we talked about diuretics as a potential to help get rid of that fluid. Another thing, we talked about antihypertensives, and ironically enough, ACE inhibitors are the most preferred because, especially if it is pre-renal acute kidney injury, ACE inhibitors are okay to take. And then another medication, we talked about metabolic acidosis. Well, we might give bicarbonate to balance that out as well. And if all else fails and kidney failure occurs, of course, dialysis is the next treatment plan we would resort to. And these patients, of course, since this is an acute or sudden issue, they typically don't get grafts. This is typically a hemodialysis catheter that gets inserted in the hospital setting, because the baseline kidney function was most likely okay, so we're going to try to get back to that baseline kidney function. All right, guys, that sums up everything you'll need to know about for acute kidney injury for your nursing exams and the NCLEX. Thank you guys so much for watching, and we'll see you in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.